Test approved by the FDA could improve maternal mortality rates, especially among Black women. The test helps identify pregnant women at risk of developing life-threatening preeclampsia within a 2-week window. So joining us with more details on how the test works and how soon it will be available is OBGYN Dr. Camilla Phillips, founder of the Calla Women's Health Center on the Upper East Side. So good morning, Dr. Phillips. Thanks for being with us.
Good morning.
All right, so this is really big news, right? I mean, so start with the basics first for those that don't know. What is preeclampsia and what makes it so life-threatening?
So, preeclampsia is the worsening or new onset of hypertension in pregnancy. It's important because it can cause, if untreated, seizures, heart attack, death. And it's important that we talk about it because everyone has risk factors potentially for it. If you're African American, having your first baby, maybe use IVF or some type of fertility treatment. Older women, we all have risk factors for it. So it's important to know what it's about.
Yeah, definitely. So how does the test work exactly?
So, what's really nice about this new test is that it's actually a blood test, so accessible to most people. It's a blood test that measures two proteins that the placenta puts into the bloodstream. When these proteins are in balance, then it predicts with about 96% accuracy that you will not develop preeclampsia in the next 2 weeks. If the test is positive, then about two-thirds of those women can go on to develop preeclampsia in the next 2 weeks. So it really tells us who we should be following carefully and possibly admit to the hospital for close intervention so we can reduce our maternal mortality rates.
So here's the thing, though. It's really hard to tell, though, the difference between preeclampsia and irregular pregnancy symptoms. So can you give us a quick rundown of what some of the warning signs are?
I can. So, the most important thing with preeclampsia, sort of the hallmark, is an increase in your blood pressure. So, any blood pressure 140 over 90 is a warning sign that preeclampsia may be coming. Other features that are important to remember is if you have a headache that isn't going away with rest, some food, Tylenol, you should not ignore that. Any changes in your vision are also important. Pain in your chest or under your right breast. Now, it can be confusing because there can also be swollen feet,
Yeah.
hands, you might feel a little fatigued. Those are really common pregnancy symptoms. So it's important to talk to your physician.
So we just mentioned earlier, so Black women have a 60% higher chance of getting preeclampsia. So can you explain to us exactly why this is?
Mhm. So, really, we know it's a combination of factors. We know that we're not genetically different from anyone else. However, there are social and cultural factors that impact our health negatively in ways that others might not experience. Also, coming into pregnancy with health related conditions such as diabetes, obesity, hypertension can increase your rate for preeclampsia. So, that's why it's really important that we focus on this population so we can always optimize health. And tests like this can help us really identify who we really need to take care of more closely.
But can it affect anyone I mean, women who seemingly are healthy? I mean, because Olympic medalist Tori Bowie, she may have died from it, right? And a lot of other athletes and celebrities have suffered from it.
Exactly. So Tori Bowie was likely a severe form of this, which we actually call eclampsia. And that's when seizures
Oh, wow.
and heart attacks and unfortunately death can be noted. People like Allison Felix, however, who are the model of health, right? Can also manifest preeclampsia. And that's why education, close intervention, and a prioritization of women's health is so important because preeclampsia really can strike at any time and anyone.
Wow. Like you said, 2 weeks after you get this blood test, you can find out whether or not you're susceptible to it, right? And then do you go?
Right. So it gives us a 2 week window to know if you're someone we need to hospitalize and monitor more closely, or if you're someone that maybe we can monitor on the outpatient setting with blood pressures, other blood work, but we don't have to hospitalize you for observation.
So how soon will this blood test be available?
So, like anything, supply chain issues, adoption of this new test, and just because you have FDA clearance doesn't mean it's readily on our doorstep. So, that's to be determined. But I hope doctors use it so we can really optimize our outcomes, especially for our Black women.
Yeah, well, we hopefully will have this approved and in hospital, in doctors' offices very soon. Thank you so much, Dr. Phillips, for your time this morning. I appreciate it.